Does this mean Christmas is cancelled this year?
I really hope not, but we clearly need to act. We talked about this on Monday when I was on the show. We clearly need to act with this rise in the number of cases. We've seen countries in Europe that have acted, like Belgium, see their number of cases come down again, and others, sadly, like France and Spain, the numbers are still going up. And some of the feedback that we had, in fact, that we talked about on Monday, was that people weren't sure what the rules were because the difference between having 6 people and having 2 households, for instance. And this is just a really simple rule, which is you now cannot socialise with more than 6 people. We're protecting schools, we're protecting work, and also we have exemptions for some really important life events like weddings, funerals, and christenings. And other than that, it's really simple.
Does this apply across the whole of the United Kingdom?
This is in England. And we've also seen a sharp rise in the number of cases in Scotland and in Northern Ireland. And we've seen the action that the Welsh government have taken in Caerphilly. So there's clearly a problem across the board. These rules are for England.
England only, but again, doesn't that add to the confusion? So this won't apply, say, in Wales or in Northern Ireland?
Well, people know which country that they're in.
They do, but shouldn't there be one blank? We've talked about this before. It does get confusing, the differences in the whole of the United Kingdom, does it not?
Well, the decision when devolution happened was that health should be devolved, and this is obviously a health measure. And so I work very closely with my colleagues in the other governments, the devolved regional governments in the UK, but this is a decision for England.
One newspaper points out that Boris Johnson, the Prime Minister, promised that there would be no second lockdown. Do you still support that assurance, Mr. Hancock?
Well, our goal is to avoid having to do anything more drastic by people following the rules.
It's not quite a vow, is it, Mr. Hancock? The Prime Minister said it wouldn't happen.
No, I won't make a vow like that, Nick. Of course you wouldn't expect me to. I'm the Health Secretary in the middle of a pandemic where we're trying to keep the country safe. But I very much hope that we can avoid that because we've seen that the number of cases, the number of transmissions is largely driven by people socialising. Our contact tracing system is able to show us where people are having that contact and catching the disease from. And actually, the proportion of people who are catching it in work is relatively low. And the COVID secure guidelines for workplaces are working. So work is safe, schools are safe, but to protect schools and protect work, we do need to take action on where it is transmitting, which is essentially socialising.
But isn't part of this increase fuelled by the fact that the testing service isn't working as well as I'm sure you and your colleagues would want it to? I read that the number of tests being processed has fallen by 15% over the past 7 days. That's failing now, is it not, Secretary of State?
No, I don't recognise that figure. We have a record capacity, and I was working on this last night because there's clearly been some challenges. That we have a record capacity in our testing system, and the problem is, and having investigated this, including since Monday when we talked about it. The problem is that there's been a sharp rise in the people without symptoms who aren't eligible for a test coming forward to get a test. Right. So we have record numbers going through the testing system, but unfortunately, the number of people who aren't eligible coming forward has gone up. So we're having to be really clear that if you have symptoms, then please come forward and get a test. Yes. But I want those tests to be available for people with symptoms.
No, but it's the Department of Health data that I'm reading, and Sarah Jane Marsh, who I'm sure you know or know of, the head of NHS testing, who's saying that it's fallen by 15%. You say you don't recognise that figure. Have you not been made aware, or is she wrong?
Well, I discussed it last night with the team, so that's the figures that I'm giving you.
So you don't recognise this Sarah Jane Marsh, the head of NHS testing and NHS data, Department of Health data, with the 15% drop, you simply don't believe it?
No, I'm telling you that the capacity in the testing system is at the highest it's been, and the challenge is that we've seen a sharp rise in people without symptoms coming forward, and that has led to people with symptoms who need a test, either not being able to get one or having to travel long distances. And I want to end that. And so part of the message that we're putting out is that if you don't have symptoms, you can't just, we've had whole schools saying that they want to come forward for testing and sending all the pupils for testing. This is not appropriate. And instead, we have to use the test for people who have symptoms until we get the next generation test, which we've talked about a lot, that can unlock a whole load of other things.
As we speak, up and down the land, teenagers are getting ready to leave home and begin their university careers. How will that be affected by this Secretary of State?
Yeah, well, of course, these rules apply to people going to university as well.
So no Freshers' Week.
Only in groups of up to 6.
Well,
that is a.
I don't know about your days, but that's true.
I know. Look, I feel.
So you've cancelled Freshers' Week, and you're going to be the government that probably cancels Christmas.
Well, the goal is that we get this rise under control, so that we can have the sort of Christmas that everybody wants to see.
But what of Freshers' Week? You're seriously expecting them all to limit themselves to parties of 6?
Absolutely. Unfortunately, it's not something that I'd want to do. But unfortunately, yes, because the spread of the disease otherwise is going to keep going up and up, and we know that leads to more people in hospital and, unfortunately, more people dying.
But why should students respect this law if your government doesn't respect a law over Brexit?
Well, of course, this is incredibly important.
You can't pick and choose the laws, can you? But actually, the government can, because it can just break a law over Brexit, as one of your colleagues admitted yesterday, Secretary of State.
Well, the government has a number of international obligations, and prime amongst those is the Northern Ireland peace process. So, obviously, the rules of not gathering in groups of more than 6, this is being brought in, so that it's super simple, really clear, easy for people to understand. Obviously, we are determined to deliver Brexit and the end of the transition arrangements with the European Union. There's been good work going on. I very much hope and expect that we will get a deal.
But I thought it was oven ready. We were told it was oven ready. What's happened to the oven, or what's happened to the deal? Have we not got it at the right heat?
We delivered the leaving the European Union. And people told me, we had discussions like this, and you told me this time last year, you'll never get it done, right? And we delivered that, didn't we?
Well, you haven't got Brexit done yet. I mean, I wish you well, because the country voted in huge numbers for you and your colleagues, but you're not there yet, and you're breaking the law, Mr. Hancock. Not you personally.
That's right. We are putting the peace process in Northern Ireland first, and I think everybody will understand why we've chosen to do that.
Nobody would welcome a vaccine, I would think, more than you and your colleagues in your department. Yeah. How much? I can imagine how much of a hit in the hopes of that is the news that AstraZeneca's had to pause trials to, I think, one person very regrettably falling sick. Health Secretary of State.
Yes. So this has happened before. And it is a normal part of a vaccine development that when you find a problem, then the system is paused whilst you investigate that particular problem. What it underlines is that we won't bring forward a vaccine unless it's safe, no matter how enthusiastic I am for a vaccine, obviously, and because it will solve so many of these problems to do with social distancing. But we won't bring one forward unless it's safe to deploy, and hence they've paused whilst they investigate this particular incident. But the good news
how much of a dent does that represent?
Well,
Secretary of State?
The good news is that we've got on order doses from many different vaccines, 340 million doses in total, which is far more than we need for the UK population. So that if one doesn't come off, and we've always, whenever I'm sitting talking to you, I always say that this vaccine technology is never certain.
Of course.
If one doesn't come off, then we've got other irons in the fire. But this is a pause, not a stop. So I'm hopeful that they'll be able to resume, but only if it's safe to do so.
Lastly, referencing a previous post as Culture Secretary, you served in that role.
Yes.
How concerned are you that Lloyd Webber is saying he might take some of his shows abroad if the government doesn't do more to help the arts and the world of theatre? Matt Hancock.
Well, the UK has always been, for centuries, at the heart of theatre and the arts, and I'm sure that it will bloom again. And one of the reasons that I don't
know if he'd say that at the moment, Mr. Hancock.
Well, this is obviously a difficult time, but I'm sure it will bloom again. And one of the reasons that we're pushing so hard on testing, which we started this discussion on, is in order to test people so that we can get the theatres full again and get our sports going as well with crowds. And that is part of the solution to this problem, the sort of mass testing that everybody wants to see. On that, I'm reliant on the technology working, the tests working, and again, like the vaccine, that's currently being validated by the scientists. And so we're pushing as hard as we can and working with Lord Lloyd Webber and the other theatre owners to try to get this going as quickly as we can.